Hi, everybody. This is Congressman Mike Levin. Thank you so much for joining us for another virtual town hall on the coronavirus. I'm truly grateful to our amazing team for helping put this together, our great video conferencing team, and everybody who's working so hard, both in our Oceanside office, our Dana Point office, and of course in Washington, D.C., where we've got some major news this week on new legislation that we'll be voting on tomorrow. In fact, I'll be flying tonight to Washington for that vote tomorrow morning. We've also got two exceptional guests for our town hall this afternoon. We've got an expert on small businesses and an expert on our healthcare, and both are certainly at the front of mind right now for everybody watching. So thank you for taking some of your afternoon with us, whether you're on Twitter, on Facebook, on YouTube. We really, really appreciate your spending some time. Our experts this week. First, we've got Danny Fitzgerald. Danny is the Associate Regional Director for the San Diego and Imperial Small Business Development Center. And of course, we know, Danny, that we've got a whole lot to talk about with regard to small business and a lot of the new federal legislation, both with the CARES Act as well as with the expansion of the small business lending program. So we're really grateful that you're here. And then, of course, I'm very happy to welcome back Dr. Carl Steinberg. Thank you, as always, for being here, Doctor. For those tuning in for the first time, Dr. Steinberg is a hospice medical director and really an expert on the elderly and on the aging, and just a great leader in our healthcare community in North County, San Diego. He earned his bachelor's degree from Harvard University, and then he went to The Ohio State University College of Medicine, and he completed his family medicine residency at UC San Diego in 1990. Dr. Steinberg, Danny, thank you both so much for joining us today.
Good to be here.
Thank you. Very good. As always, the number one thing we can do throughout this COVID-19 crisis is to follow the recommendations from our federal government, our state and local government. And I'm so grateful to all in our community who are doing just that. The numbers continue to be very troubling. Unfortunately, we continue to see both the rate of infection and the death toll in the United States climbing. And we've got, as I'm sure you all know, the most confirmed cases of coronavirus in the world by a lot in the United States, with 835,316, along with 45,950 deaths, tragically. California has confirmed 35,905 cases, with 1,334 deaths. San Diego County has confirmed 2,434 cases, and Orange County has confirmed 1,691 cases. A little bit misleading, though, because San Diego County has tested roughly double the people of Orange County, despite the fact that the two counties have roughly the same size population. There have been 87 deaths in San Diego County and 33 in Orange County. And look, these are so much more than just statistics. These are families, these are people in our community that we know and love, and our hearts go out to everybody who has been impacted by this, who have loved ones who have been impacted by this. We're thinking of you. We've got to just work together in a spirit of kindness and generosity to get through the worst of this, to begin to get things back on track. I can tell you that in San Diego and Orange counties, there are signs of optimism. We do know that the early measures that the state took and that many of our cities and counties took actually did a lot to help alleviate some of the community spread. And now, of course, we need testing, and more testing to begin to get things back on track. And that's part of what we've been doing with this latest bill in Washington. And what I'll briefly do is just walk you through where we've been legislatively with regard to COVID-19. We started with our first bipartisan bill on March 6th, I believe was the day that it was eventually enacted. $8.3 billion really for the development of the vaccine. That was the focus at the time. Then a couple weeks later, we did what's called the Families First Act, a $200 billion bill focused on emergency sick leave and family leave, as well as more funding for nutrition assistance and for Medicare. And then a couple weeks after that, we passed the CARES Act, which you probably heard about. That's a $2.2 trillion bill, included a lot for public health, included a lot for economic situation as well. I have said before and will say again We've got two crises, a public health crisis, an economic crisis. The only way we're going to solve the economic crisis is if we fully address the public health crisis. In other words, we can't have a healthy economy unless we've got healthy people. So that's what I am committed to doing in Washington, D.C. The CARES Act, when it comes to the public health crisis, $100 billion for hospitals, $150 billion for state and local governments, roughly $20 billion for the VA and specifically for veterans health care, and another $16 billion for things like personal protective equipment and the national stockpile. And then on the workers' side, of course, we had the expanded unemployment insurance, an extra $600 a week. And I know many that are watching, hopefully, if you have applied through the California EDD, you've now received those benefits or begun receiving those benefits. If you're a 1099 independent contractor or a gig economy worker, our hope is that the state will have a portal up and running this week so you can apply and you can 4 months. So, it's a big deal in California where the maximum unemployment benefit went from $1,800 a month now to $4,200 a month on a temporary basis as we get through the worst of this pandemic. Second, direct cash payments. 80 million Americans who are electronic filers with the IRS have already received cash payments of up to $1,200 per person and $500 per dependent. And I know from anecdotal evidence, talking to a lot of people in our communities, that a lot of folks who are those electronic filers have received those funds if they're eligible. Then the third, of course, is small business lending, and specifically what Danny is here to talk about, the Paycheck Protection Program and the EIDL Disaster Loan Program. We funded the Paycheck Protection Program with $350 billion. And the idea is to help businesses of under 500 to survive the worst of this, to be able to basically have 8 weeks worth of fully forgivable loans, so long as those loans are used for payroll, overhead, utilities, and basic expenses like that. They're fully forgivable loans to be administered by the over 3,000 lenders that already do business with the Small Business Administration. The popularity of that program was really unprecedented, and the funds were exhausted really even faster than anybody thought would happen. So what we have done is, you could call it like Bill 3.5, because it's not a new fully fledged piece of legislation, but it really is an expansion. In fact, I have it here. It's 25 pages. If you can imagine, guys, $484 billion in 25 pages. So I don't know how many billion that is per page, probably 20 or $25 billion per page. But it's a lot of money. 310 billion of additional funds to the Paycheck Protection Program. Of that, $60 billion carved out for small mom and pop businesses doing business with smaller community lenders. And hopefully, Danny, we can talk about some of that. The idea here is, we read the stories and we're frustrated just like everybody else, hearing that people who should be getting these funds aren't able to access them. It shouldn't be how connected you are with a big bank. It ought to be how much you need those funds for your business to stay afloat. And that's what we're intending to do. Secondly, $75 billion in additional funds for hospitals and frontline medical professionals. So important that we did that. And the bill, as it was originally developed by Mitch McConnell, he said, take it or leave it, $250 billion for the PPP, for the small business program. We wound up fighting very hard, and we got $75 billion for hospitals. We got additional funding for small businesses, and we got money for testing. So critically important, $25 billion, and very, very important. In the bill, it requires the administration to have a national coordinated testing strategy for both the standard diagnostic test as well as the antibody test. And Dr. Steinberg, I know we're going to have some questions on that about the importance of testing, but I think we know from all the public health experts, we need testing, we need contact tracing, we need treatment, and I know a lot of people in our community are working on treatments, and eventually isolation, so that we can move from that mitigation to containment. And then, of course, at the same time, trying to develop the vaccine. So I'll be flying, as I mentioned, tonight on the red eye, arriving tomorrow morning for the vote. Importantly, we're also voting to create a select committee to oversee how this money is spent. That's the other vote that is occurring tomorrow. It's going to be chaired by Jim Clyburn, a member, a very senior member from South Carolina who serves as the House Majority Whip. And the idea is to create a committee analogous to what Harry Truman led when he was a senator during World War II, overseeing expenditures, trying to find waste, fraud, and abuse in the system. That is the jurisdiction of that new select committee. So I'm a strong proponent of that. We're trying to do a lot of other things as well. And I thought I would just briefly mention in the next bill, which we're calling CARES 2, the sequel, because we know that what has already been passed is not sufficient to fully face the challenges that we face, whether it be the public health challenges or the economic challenges. We're going to need to do more. I want to see a lot more funding for our state and local governments, and that includes cities that are smaller than 500,000 people, which were excluded in the first CARES Act, including our cities in North San Diego County and South Orange County. I've been speaking and talking to our mayors and our city managers, and I hear the challenges that we face at the municipal level, and I'll do everything I can to fight for them. We need additional nutrition assistance, no question, and we need to stabilize the funds of the United States Postal Service. The USPS is in desperate need of help, and I look at it personally, chairing the subcommittee on veterans employment, that over 100,000 veterans are employed at the United States Postal Service, so we've got to do right by them as well. I'd also like to see funding for national vote by mail. I thought we needed it before COVID-19 and after what happened in Wisconsin, where you saw people making the decision whether or not to vote or to stay healthy. We absolutely need national vote by mail, and I'll fight for that. We also have something called the COVID-19 Graduate Relief Act. It would provide relief from student loan debt for those who are graduating this year who aren't able to find employment. Additional funding for schools. I've advocated, we had $31 billion for schools in the CARES Act, and I've met with most of our superintendents locally, and we need more help for our schools. We also need more help, not just K through 12, but also for higher education. I was happy that in the first CARES Act, we now know that our local universities and colleges got $44 million, $35 million for UC San Diego, $5.5 for Maricosta, and $4.3 for Saddleback. And we're going to have to do a lot more. Also, I'm working with Republican Rodney Davis, who's my friend from Illinois, to try to get our Prevent Family Fire Act into the next COVID relief bill. This would create a tax credit for safe storage devices for firearms. We know that when firearms are locked in the home, that the risk of accident goes down by 74%. And this modest bill, which is a bipartisan bill, would allow people to get a tax credit for the purchase of those safe storage devices. So we're very hopeful we can include that, particularly at a time when people are at home as never before, where children are at home. We also encourage, if you are at home, we know that the rate of domestic violence is going up at a very alarming rate. Please seek help if you need it. You can contact the National Domestic Violence Hotline as well. Two more things before jumping into Danny and to Dr. Steinberg. This past week, we led a couple of letters, one to FEMA, trying to figure out what the heck is going on with the seizing and reallocation of PPE, ventilators, and other really important supplies. I want to see that pipeline of necessary supplies get to the states and the frontline medical professionals who need it the most, and they need to act in a transparent way. Second, I led a letter with about 72 of my other colleagues signing on to try to make sure that in the next round of hospital funding, which we now know is going to be another $75 billion, that we look at community health centers and others who were left out of the first bill. So we need to do everything we can to work together as a community to try to get it right with this next major coronavirus relief package. We welcome your ideas. We know people are really struggling out there, but my great hope is that this bill that we're signing tomorrow will help a lot of small businesses, will advance testing, will help our hospitals in a meaningful way, with much more to come. So with that, I'm going to first turn it over to Danny Fitzgerald to talk about some of the recent developments with regard to small business. Danny, take it away.
Thank you, Congressman, and I appreciate the opportunity to come onto your town hall. We as the Small Business Development Centers. We're funded by the U.S. Small Business Administration as well as the state of California's Governor's Office of Business and Economic Development. And we're a resource partner of both of those entities to really be able to work with small businesses at no cost to them. But the primary way is we provide free one-on-one business advising as well as a number of different trainings. We've been around in San Diego for well over 30 years. We have a team of well over 90 folks who are working online remotely, and we've helped well over 3,500 businesses. And so we're really here to help people understand how to apply for the federal assistance, understand local assistance, what you need to do to minimize your cash outflow, to prepare your financials, to be able to apply for the different programs and really take advantage of the assistance that's out there. But not only that, to also just be able to listen to you, help you make some of the hard choices or different choices you haven't really thought of before, and really be able to do it. We've even gone down to helping people pivot some of their marketing and even take it, and be actually continue to, to have their business thrive in completely different ways. And so that's really what we're here to do. We're super excited that of course the Senate yesterday, and Congressman, you're flying out tonight to be able to vote to refund the PPP and EIDL programs. We've helped thousands of folks apply for both of those programs. We have seen some get their approvals and be able to take advantage of that program. As people are getting their approvals, of course, with PPP, talk about what they need to do to ensure that they take advantage of that the right way, the way in which the legislation was intended, so that way the loan could become forgiven, basically can become a grant by paying your employees, and understanding, of course, that even if you're paying your employees, that doesn't necessarily mean that they're working. It means that you're paying them as though they were working, and that's something. And then again, to take advantage of the economic injury disaster loan, we've seen, of course, hundreds and thousands of businesses already start to get their advances. We've even seen some that applied early on the first week of the crisis, the week of March 16th. We've seen those folks actually get their loans approved and get their disbursements to really be able to bridge the time frame that they have. Again, the Small Business Development Center, we're here to be able to assist businesses. We provide on-demand trainings on how to apply for PPP, EIDL. We have our team of 80 plus advisors working every day, all day, helping folks apply for these, and as well as navigate everything else that they need to do. And again, we're a no-cost service, and we're funded by the U.S. federal government as well as by the state of California. And we're really here to help, and we appreciate the opportunity to come here, help people better understand these programs and understand that it's not, that there's a lot of noise out there, there's a lot of confusion out there, but we're here to kind of help cut through that noise, help cut through that confusion, help you get exactly what you need done, so that way you can keep your business open and on the other side of this crisis be able to thrive.
Thank you so much, Danny, for joining us. And I know you're going to be really, really busy in the next few weeks and months. With that, I'd like to turn it over to Dr. Steinberg, who joins us again for any opening comments you might have, Doctor, and then we'll go straight to questions after that.
Yes, thanks. It's good to be here with you again. And I'll just preface it again by saying anything I say today is it's based on me as a person, and I'm not trying to represent any of the organizations that I'm on the boards or an officer of, like AMDA, the Society for Post-Acute and Long-Term Care Medicine, or California Association of Long-Term Care Medicine, or San Diego County Medical Society, or the Coalition for Compassionate Care of California, or any of those organizations. Just me. And I'd say, there's some new information coming out that we'll probably have some questions about. I think testing is a big item, and California has again shown itself to be a little bit ahead of the curve with some guidelines that are going to allow for kind of prioritization of testing of certain asymptomatic people. In other words, people who are just at high risk for bad outcomes, but don't necessarily have an exposure or symptoms, like people who dwell in nursing homes or assisted living, which is where I normally hang out. So I was very happy to see that. Also, California issued the statewide crisis care guidelines a couple days ago. they're pretty comprehensive. This has to do with triaging, and fortunately, we have not gotten to that point as they have in other parts of the country, thanks in part to good people like our constituents here adhering to the social distancing guidelines and staying at home. Also, from the federal government and from the state, there's now a requirement for reporting of outbreaks in skilled nursing facilities and other congregate living facilities. So I think that's important. I think transparency is important. And you're probably aware that about a quarter of the deaths nationwide have occurred in those settings. And that's a hugely disproportionate amount. And I think the reasons for that are clear. Also, San Diego County, we did have a little bit more of a bump yesterday than we've had in a couple of weeks. I think in part it's due to the fact that testing is more widely available. And the other sort of somewhat alarming thing that we heard, and I'll temper it by saying we've heard from the beginning that it's going to be a marathon, not a sprint. But that things may get a whole lot worse, around wintertime, with a resurgence of COVID cases plus the regular seasonal flu and so on. And so I think we just need to be mindful of that. And but on the whole, things could be a lot worse. And I've always been a glass half full kind of guy. So I think we've been pretty blessed, especially in Orange County and the north part of San Diego County. With respect to at least the number of deaths and serious cases. So that's it. Thanks.
Thank you, Dr. Steinberg. We got a bunch of questions. One last thing before we begin, I want to encourage everybody. We put up a great resource guide on our website. You can go to mikelevin.house.gov/COVID-19. It has a lot of information about pretty much everything that the federal government has been doing with regard to coronavirus, including all the small business information that Danny, I think, is a very, an expert among experts when it comes to this stuff. So we thank you, Danny. We like to think we've got a couple of experts on our team also. So we look forward to working with you in the weeks and months ahead. Also, the National Domestic Violence Hotline, thought I would just mention it, is 1-800-799-SAFE. Again, that's 1-800-799-SAFE, and people can also text to that number as well. We've got a ton of questions. We'll get through as many as we can. We will start with Michael in San Clemente. Michael asks, according to the current SBA guidelines, when PPP funds are returned to the program, as is the case with Shake Shack, I think people are familiar with that, Danny, that Shake Shack got $10 million, if I remember, and decided to return the money. When they return the funds, these funds cannot be dispersed or assigned back into the program. What action are you and other elected officials taking to fix this issue and reallocate these funds? Secondly, can the public see where the larger PPP loans went to in terms of size and scope of the loan, say the $5 to $10 million range? Well, that is a great question, one that we had as well, Michael, when we read the report about Shake Shack. And what SBA said is that they can award the funds returned by Shake Shack as soon as there's new funds that are allocated by Congress, which was the case or is going to be the case as of tomorrow with that extra $310 billion that we're allocating into the PPP program. I agree with you that PPP loans should be completely transparent. The SBA, after some arm twisting, frankly, did release some information on Friday that I think was instructive, but not completely transparent. We did see that the average loan was around $200,000, if I recall, Danny, something along those lines. And also we saw that California actually, small businesses in California got less money than they did in Texas. So that was kind of interesting, given that California has a bigger population than Texas. I think it was 33 billion to Texas and 28 billion to California. So we'll be, continuing to ask tough questions about this program. And then the idea with the $60 billion set aside for smaller and community-based lenders, including for those businesses who are not engaged with traditional banking relationships. was to try to avoid another Shake Shack like scenario, or Ruth's Chris Steakhouse, or Potbelly sandwiches. And I like all of those things, but probably not the best use of those funds. Danny, anything to add?
The only little bit I will add is we have, locally seen some success with some smaller ones who have seen PPP loans come through that are in the sub 50,000 loan range. And so that's been encouraging to see. I think the other thing is to recognize that the early data is a little bit skewed towards the larger loans, just because the nature of the way in which the program was rolled out from the banks, because the banks also still had to comply with the Patriot Act and known entity rules, basically saying that they know who they're lending the money to. And so that's where a lot of banks worked with their existing customers because, well, they already knew who they were. And so I think that was a component. It'd be interesting to see in another week with additional data, because what we saw was the majority of the sub 15 employee companies, they were able to get their loan approvals right at the tail end, or actually they've been coming through after the switch was turned off.
Thank you, Danny. Zachary in Vista asks, there is talk of a fourth stimulus package already in the works. I think many Americans are wondering if there will be another economic impact payment included, and if so, will there be more than one? Well, I certainly hope that there will be, Zachary. I've been advocating for basically direct payments to be commensurate with the state of our economy. So I'd like to see some sort of trigger, whether it be the unemployment rate or the gross domestic product, where the payments would continue in some way, shape, or form until we see the type of rebound where they would no longer be warranted. I'm absolutely convinced that one direct payment of $1,200 is not stimulative enough regarding so many who have lost their jobs. 22 million have lost their jobs or have filed for unemployment. Obviously the expanded unemployment, I think, is really a good thing. However, it too will run out in just a few months, which means we're going to need a massive jobs program as part of the fourth bill. And I would certainly be supportive of direct cash payments, in addition to other measures to put millions of Americans back to work. George in Cardiff by the Sea has a medical question, doctor. Says, my father is a Marine Corps veteran who needs hydroxychloroquine to treat a medical condition related to Agent Orange exposure. Because of the president's advocacy of this medication, there is a severe disruption in the supply chain, and so my father cannot refill his prescription through the VA and cannot get his medicine. What is being done to protect the lives of patients who need this medication for FDA-approved reasons? Oh, and Dr. Steinberg, I think you're on mute. There you go.
Yep, sorry about that. Yeah, thanks for the question. Excuse me, and thanks to your dad for his service. It's ironic that they just came out with this information today from a somewhat small study, a few hundred patients from a VA, that it appears that the death rate with hydroxychloroquine is considerably higher than it was without it. This drug has some potential cardiac problems, and I mean, it's unfortunate that it's become sort of a political issue as opposed to a scientific and medical issue. And it's especially unfortunate that people like your dad are kind of caught in the middle. I know that there's been a stepped up production for hydroxychloroquine, so I think most likely it will become a lot more available in the near future, probably within a matter of weeks. In the meantime, I don't know your dad's specific conditions, but there are medications that can be used short term that are similar, maybe not identical. They all have risks, and it's always a shame to have to use something different once if it's not broke, don't fix it. It's working fine. He's tolerating it well. I would also suggest that if he hasn't already done it, to check with his doctors and call around to local pharmacies, because some still have some in stock. It's not completely out of stock everywhere. And I would just say, we're all hoping there's some kind of magic bullet that will cure this illness, but it doesn't appear right now that hydroxychloroquine is that magic bullet. So I hope that'll be a short-term deal for your dad.
Thank you for that, Dr. Steinberg. In addition, I know that we have asked the White House Coronavirus Task Force to ensure that hydroxychloroquine and chloroquine are available for lupus and for rheumatoid arthritis and other conditions, other patients with those conditions. Obviously we're following this very closely. And we all saw that study that Dr. Steinberg referenced from the veteran community as well. Jerry in Oceanside, and this is a small business question for Danny. I'm a small business owner in Oceanside, and like many others, are seeking financial assistance in the midst of the shutdown. Specifically, Wells Fargo is my bank, and I followed guidelines to apply within hours of the process being authorized. I was told that my business application was in the queue, but that they couldn't do anything as they were tapped out. Apparently, the restrictions in California were not lifted due to the problems they had with the state, respective of opening accounts without authority. After 40 years with this bank, personal and business, I am at a loss. My question then is, will Wells Fargo be able to get the restrictions lifted to increase the customers they serve? If not, where else can I turn to get financial relief, as supposedly banks are only dealing with customers who had business accounts prior to February 2020?
Yeah, so I can't speak specifically to Wells Fargo's business practices, but what I do know is that how basically the process worked is a bank would receive the information from the borrower, from the customer, and this would be with any lender or any bank. They verify that information, collect that information. Then internally, they do have a queue, or basically a funnel where then they have to submit that information to the Small Business Administration. I actually spoke to one banker that was last week up till like the middle of the night on Thursday, was submitting those applications until the switch actually got turned off. And so a number of lenders, Wells Fargo included, have continued to receive those applications and collect that to verify that information, basically making sure the application is complete and accurate, because that is their job, and that they've done the known entity verification requirements. Then as soon as this gets passed back into law, the president signs it. The Small Business Administration, we're anticipating, will turn their portal on, their communication portal with the banks, and then they will be processing that. So my suggestion to you is to check with Wells Fargo to see if you're in their queue. Number one, see that they will be intending to submit your application to the Small Business Administration when they turn the portal back on. That's the most likely. We know of thousands of businesses that are in that exact same situation. And frankly, the lenders, the moment that the switch was turned off, they anticipated more money coming down, and they've continued to collect these applications to do their work on the front end, working with you, the business owner, making sure your information is accurate, correct, and complete. So that way they can easily process that information with the Small Business Administration to get you your approval. That said,
go ahead, Danny. Sorry.
One question. So if you were not successful and they don't have you, there are other lenders out there that are taking different applications. You can work with us. We can help you kind of point to different ones depending on what your situation is, of ones that are taking new customers, and they have some different ways to verify the known entity.
Thank you, Danny. Ruth and Encinitas asks, I electronically filed my individual federal income tax return on March 20th, 2020. To date, I have not received my tax refund. I am concerned that I will not receive my refund because all federal money is being paid to stimulate the economy and relieve the unemployed. Do you have any information on this? Well, Ruth, nobody's tax return is going to be held back because of these direct payments. Or any, for that matter, any of the other CARES Act provisions, whether it be the expanded unemployment insurance or anything like that. You will receive your tax refund, and there's nothing about the coronavirus relief programs that are going to prevent that. And if for whatever reason you still haven't received it in the next little bit, feel free to contact our office. We'd be happy to look into it and work with you on it. But no, that's not something that you need to be worried about. Will in Escondido, here's another one for Danny, says, I have a small business in Escondido. We signed up for the Paycheck Protection Program Friday morning, April 3rd. No funding as of Tuesday, April 14th. My question, how many small businesses have actually been funded nationwide? And he asks in Escondido, I'd be interested to know kind of locally in San Diego.
So I don't have the numbers at the top, but I do know it's a few there were millions of the applications that were actually approved, as the congressman was talking about at the beginning of that. We don't have the data all the way deep dive in terms of it from a zip code basis. All we have is a state by state basis for the Paycheck Protection. We also do know that on the flip side of the Paycheck Protection, the Economic Injury Disaster Loan, the vast majority of the funding for that has actually come to California. About $1.3 billion has come to California, and which is by far and away the most. In terms of your specific situation, reach out to who you applied with. Because I know that what were out there, there were ones saying that they were PPP approved lenders that weren't actually SBA approved lenders. That what they were is they were acting as a broker trying to find a lender. So whoever you put your application in with, reach out to them and get a status update. Find out, as I was explaining with the last question, if you're in the queue for them to submit your application as a lender, or if they're an information person or a loan broker trying to find you a lender. And so if you need some additional assistance with that, we can kind of help you craft with those types of questions as well.
And our next question comes from Bob in Carlsbad. He asked, why would we bail out cruise ship lines if all but one are foreign corporations? I agree with you, Bob. I don't think we should bail out cruise lines. We haven't been. They don't qualify under the CARES Act because at least if they're the foreign corporations, they don't qualify under the CARES Act. And look, I'm not picking on cruise ships, insofar as, my own family, we've taken cruise vacations before over the years, and we've had a good time. It's not about picking on an industry as much as it is ensuring that those companies that we are helping are American companies. Pretty simple. And really, at the end of the day, my focus has been on small businesses and on local businesses. And that's why we just did another $310 billion in the Paycheck Protection Program. That's why we just did more money for emergency disaster loans. I will be a strong advocate for our small businesses, and moreover, making sure that more of those funds go to the mom and pop businesses that need our help the most. We'll continue to monitor, obviously, what's happening across the board. But our focus has to be on our workers, our families, and the health of our communities. Alyssa in Oceanside says, it's another Danny question, very popular today. I applied for an EIDL loan March 31st, but have not received any communication at all from the SBA. I've tried calling, but the call center does not have any information on the process other than, quote, you'll receive an email within 7 days. Then it was 10 days. When I called yesterday, they said it would take up to 3 weeks. Do you have any additional insight on this program or direction on how we should proceed?
So number one is, since you applied March 30th or later, that means you were in a simplified application where you would be eligible for the up to $10,000 advance. What we're seeing from our small businesses is that money just appears in your bank account. So first thing to do is check your bank account, the bank account you submitted, and you may see a deposit in there from the Small Business Administration or from the U.S. Treasury, probably be from the U.S. Treasury. And we've seen those dollar amounts just put in there. Know that there were over 3.5 million applications submitted for the Economic Injury Disaster Loan. And the Small Business Administration, before all this crisis started, had a team of only over, no more than 100 people being able to handle these types of loans. They're staffing up and trying to get to that information. So number one, check your bank account. Hopefully you've received that Economic Injury Disaster Advance, because that's what we're seeing, is that there's no communication, just the money appears. Number two is, do check, make sure you continue to monitor your email. We're seeing some of those do go out. Many are receiving, and of course, we've seen some in your situation where they did not go out. And unfortunately, the only number you do have to call is that 800 number. But they're staffing that up as well. And my understanding is with the bill that the congressman's flying out to vote on tomorrow, is there's additional funding also for the Small Business Administration to handle the processing of these loans.
I think it's a pretty substantial sum of money from what I remember also. So we certainly hope that that's the case. Here's an interesting question because it's both a small business question and a medical question, all wrapped into one. So I'm going to start with the doctor, and then we'll see, Danny, if you have any additional small business related advice. This is from Kathy in Laguna Niguel. Kathy says, I own a retail store with 8 employees, and we're preparing for when we can come back together and open the store. If we don't have testing, how do we know it's safe for us all to work side by side? Is there a liability? Should come back to work policy be voluntary? Interesting. So there's a testing component here, and I'll start with that for Dr. Steinberg.
Yeah, and first thing I would say is that I hope that we will have enhanced access to testing very soon, and so that'll become less of a problem as it still is right now. As far as whether it should be voluntary, excuse me, I'm a big believer in autonomy, and I don't think anybody should be forced to go back to work, but people do have economic realities that they have to deal with. And this entire crisis, I think, as we try to get back to something that will become our new normal, it's all about kind of risk reduction, harm reduction, and there's always going to be risks and benefits to whichever choice people decide to make. So I wish I had a simple answer for you. I certainly wouldn't force somebody to come back to work, particularly if they're at high risk for severe disease, maybe even if they live with somebody that's at high risk. But I think with continued masking and good disinfection processes, assuming that your employees are fairly healthy, I think it'd be fairly low risk.
Danny, any additional thoughts for our small businesses out there weighing these decisions?
Yeah, these are tough decisions, and I think number one is continue to follow the guidance that's coming out from the state of California and the county of San Diego. Governor Newsom did put out kind of his 6 steps, his 6 things that need to be done. The county public health is doing the same. There's of course the state task force as well as a local task force about discussing those things as to what that's going to look like. We've met once with that task force here locally, and are going to continue to have those conversations. But what I'm understanding is there's going to be specific rules as to how you're to handle both the workplace safety for yourself as well as your customers. I do know that there have been, the different pieces of legislation that the congressman spoke about, additional sick leave and other options for people that if they're uncomfortable or if there's, or in particular if they're at risk, in terms of their come back to work situation. But, we're going to work very closely, in particular with the County of San Diego, as public health rules adjust, and understand that it's going to be a very fluid and dynamic situation. And and I think that's the most important thing is monitor what those rules are and comply with them the best you can.
Thank you for that. Danny, another one for you from Lori in Oceanside. Assuming eligibility, can you apply for both PPP and PUA? And maybe you want to just take a second and explain the difference for the audience.
A lot of P's in there. So Triple P, Paycheck Protection Program, is for small businesses and PUA is Pandemic Unemployment Assistance, also part of the CARES Act. And in short, the answer is no, you cannot apply for both. They're both federal funds, they're both federal sources. And so as the congressman talked about at the beginning, the Economic Development Department, the Employment Development Department will have applications available very soon with the state of California. They have some guidelines up at both the California Department of Labor as well as the EDD's websites. But you cannot apply for both. So for folks that are gig workers, independent contractors, self-employed, sole proprietors, etc., people without employees, in short, if you do not have employees, do the math. What is more beneficial to you? Is it to receive 8 weeks of the equivalent of what your net profit would be, or would it be to get the $600 per week from March 29th through the end of July? So to kind of do that math, it really is a math equation as you're particularly having to choose between those. If you have employees, you need to go with the Paycheck Protection Program because that's what's going to help them. But if you do not have employees, we're seeing probably 95% the math works better for them to take advantage of the Pandemic Unemployment Assistance.
Very interesting. Thank you, Danny. Next question for Dr. Steinberg from Linda. She asks, I'm interested in finding out how to do contact tracing of suspected coronavirus infections Who is doing the tracing, and how can I get involved?
That's a great question. There's another little P acronym, PUI, right? A person under investigation for the illness. So we've got our medical ones along with the economic ones. So this, in a small epidemic, contact tracing is fairly, I don't want to say it's easy to do. It's like detective work, but it's probably much simpler than it is with something that is as large scale as this pandemic. I think Mr. Levin was talking about mobilizing a lot of new workforce people. This could be a place where your help might be needed in this. But as of now, I really can't tell you any concrete way to go about volunteering for this type of work. And Mike, maybe you have some additional insight into that.
Well, I guess two things that I would say. One is there's a California Health Corps, and I would imagine that people could sign up through the ca.gov, through Governor Newsom's efforts there. The other, there are efforts in Washington where we're talking about maybe utilizing AmeriCorps, folks who are doing AmeriCorps for contact tracing. The estimates that I've seen are that we need anywhere between 100,000 and 300,000 people throughout the United States who are dedicated to contact tracing. One good piece of information is that because the new bill that we're passing tomorrow compels the administration to create a national testing strategy, my great hope would be that as part of that national testing strategy, it would include how many people we're going to need for contact tracing, along with how many tests we're going to need. Again, we're testing on the order of 150 or 175,000 people a day. We need to ramp that up very, very significantly. Estimates I've seen, 500,000, 700,000 a day. And then we're going to need contact tracing all over the United States. In addition, as we've said before, to the treatment and the isolation. So I hope that between the federal government and the state government here in California, we figure it out and we direct people as appropriate. But I really, Linda, appreciate your interest in doing this. Kale has a question, and I guess this was from our last town hall that he offered in the comments. In spite of the COVID-19 shutdown, Edison continues the non-essential loading of spent fuel at San Onofre. The loading and decommissioning processes should not be considered essential energy infrastructure, as San Onofre has not produced electricity since 2013. Will you please contact Governor Newsom about this? Well, I've actually already contacted Edison International about this and tried to get a clear answer from them. They wrote me back, but they really didn't do anything to mitigate my concerns around their belief that the movement of spent nuclear fuel consists as essential use. The way I read the essential, non-essential in this context, it's one thing if you're producing electricity that you need the support to be able to keep the lights on in hospitals and in our homes. Another thing entirely, if you're moving around spent nuclear fuel for a power plant, as you said very well, Kale, for a power plant that's been not producing electricity for a number of years. So we're going to take next steps as appropriate, and that could include contacting Governor Newsom, yes. Number 14, let's see here. Oh, here we go. Next question is from Jeremy. I'm a small business with 4 employees. This is a Danny question, it appears. I'm a small business with 4 employees, and I applied for the SBA's EIDL, which was intended to give a $10,000 loan advance to businesses. Suddenly, the SBA changed the rules weeks after the program started, and it is now only giving $1,000 per employee. Small business owners are now carrying significant personal financial risk to keep our team employed with the expectation of help, but the SBA keeps changing the rule. Is help actually coming, and will the SBA make the EIDL's full $10,000 promised at any point in the future? I appreciate that the PPP is apparently also available to me, but we all know how that has rolled out. For Danny.
So I understand the confusion around the up to $10,000. We understand I do not work for the Small Business Administration. I'm not the SBA administrator, and we're resource partners of them and understand that confusion. We were trying to find that out as well and understand how that particularly works. But we know that that's now how they've interpreted that particular ruling. That's the formula that they've created. And at this point, I do not know if they're going to go retroactively change that with the additional funding or not. But I do know that those are getting issued. Like I said, with an earlier question, check your bank account. Hopefully it's magically appeared and you're able to take advantage of those funds. What I do know is that they also are processing the additional loan amounts for the economic injury disaster loans. There have been, in the state of California, about $1.3 billion worth of loans approved already for economic injury disaster loans. And we've seen those in San Diego County as well, and seen them, in amounts from $50,000 to $500,000 actually get approved and for them. The PPP program, I know it's been a bit frustrating. As I said before, make sure you're able to get your application in. The banks are verifying that information, or other lenders, and that way you're going to be able to get the PPP loan with this next tranche of money.
Thank you, Danny. Next question from Erica. Erica asks, Congressman, what is going on with the U.S. Postal Service? Why isn't it getting the funds it so desperately needs? Well, Erica, that is a fantastic question. I completely agree with you that we've got to do all we can to stabilize the finances of the post office. And we know that because of this pandemic, that it is losing tens of billions of dollars of additional revenue that it desperately needs, because it wasn't on the greatest financial footing to begin with, because a lot of the very restrictive criteria that Congress imposed on the USPS in terms of their finances and their long-term retirement obligations of the Postal Service workforce a number of years ago. But make no mistake, we've got to save the Postal Service. It is so critically important. And, in addition, for me, chairing the Veterans Economic Opportunity Subcommittee, the fact that well over 100,000 veterans are employed by the U.S. Postal Service is a huge, huge number. And we've got to be absolutely mindful of the fact that if we, talk about our veteran employment numbers remaining high, particularly after the hit that this pandemic will take on the veteran workforce, we've got to make sure that we keep the U.S. Postal Service afloat and on solid footing moving forward. And I'll be absolutely fighting for that as part of the next coronavirus relief package, CARES 2, as we're calling it. Thank you very much for the question. The next one from Michael. When will Californians get the federal unemployment payments? I am still waiting for mine. Well, it probably does not surprise you, Michael, to know that we have been getting this question an awful lot from our constituents, calling us and writing us, both in our district office and in Washington. The way that the unemployment insurance process works is it's administered through the states, and specifically in California through the EDD. And if you go to their website at, I believe it's edd.ca.gov, they have said that they have a portal that will soon include additional information for newly eligible independent contractors and gig economy workers, so that they can file and receive their expanded unemployment insurance as well. We basically, as Congress, we imposed two new things on the states with regard to unemployment insurance in terms of an implementation or logistics process. One, $600 extra a week, and two, expanded eligibility for gig workers and 1099 independent contractors. So between those two things, it really did wreak havoc on some states' back end in terms of the technology necessary and the systems necessary to make that happen. I spoke with the California Secretary of Labor not long ago, end of last week, and she assured us that they are working very hard around the clock at EDD to get that up and running. But don't hesitate to get in touch with our office if you need any help. And the EDD's office, now they expanded their hours for their call center on the basis of people having, obviously a lot of questions and a great deal of concern about those payments going out in a timely way. Dan in Ladera Ranch has the next question. Is it true that oil and gas companies are receiving a direct taxpayer-funded bailout in addition to other indirect forms of support. No, that is not true. What the president did want to do is he did want to provide a bailout to them. I believe it was $4 billion. And we said no in Congress. And we fought very hard for parity between fossil fuel and clean energy. I'm a proponent in the clean energy industry and in the clean renewable energy jobs of the future. And we know from data that the renewable energy industry and the clean energy industry has been hit hard by the pandemic as well. Recent analysis that I saw suggested that over 100,000 jobs in clean energy have already been lost as a result of COVID-19. So all we were asking all along was for fairness and equity in how the fossil fuel industry and the clean energy industry was treated with regard to any of these funds. Subsequent to that, the president has made additional overtures to the fossil fuel industry, including just a day or two ago on social media. We're going to continue to fight for fairness and equity and a more sustainable future. That's what I'm committed to. I'll always be committed to. And today being Earth Day, I think it's particularly appropriate as we celebrate the 50th anniversary of Earth Day to think about good public policy that follows the science, whether it be regarding the pandemic and making sure we're following public health experts and the medical professionals and all those who are telling us what the science dictates. Just the same, we've got to remember the importance of science when it comes to our public health and our environmental policy as well. And if we do so, I know that we can meet the challenges that we face. Thank you for the question. Jody in Oceanside, she has a medical question for you, Dr. Steinberg. My wife, Lee, and I are residents of Ocean Hills Country Club, a 55-plus active adult community of 1,600 homes in Oceanside. I'm very familiar with Ocean Hills. Hello to everybody watching from Ocean Hills. The average age of our residents is 75, with many having underlying health conditions. I have only seen directives specific to nursing homes and assisted living, not communities such as ours. Well, our clubhouse and everything is now closed. Absent a vaccine that everyone takes, will this ever end for us? Does the county and state have any thoughts?
Yeah, thank you for that question. I'm also very familiar with Ocean Hills, a lovely neighborhood, and I've made many house calls and taken care of lots of people that live up there. Many people have been asking similar questions, especially elders who are always going to be at higher risk for severe complications and death from this virus. I wish I had a simple answer. I think moving forward, our new normal will never be what it was before. I think we're always going to have to take heightened precautions, at least until such time as we do have an effective vaccine. And that may come sometime next year, but we just don't know for sure on that. So I think in the meantime, it's all about risk reduction and, what is an acceptable level of risk for you. Certainly, it probably won't be a whole lot longer before they reopen the clubhouse and things like that. Staying 6 feet away from people, wearing a mask, being meticulous about hand washing, and other sort of disinfecting surfaces and things like that. Much of that may be part of our repertoire, especially in people who are considered high risk, the older population, for quite some time to come. So I don't want to paint a, an unrealistically rosy picture. I think I would hunker down for that, and if somehow things are better, that'll be great. But that's my thinking as a geriatrician.
So, wow, really the new normal in a community like that for the foreseeable future is going to be things like social distancing you foresee?
I think so. I mean, now if we've got widespread, ineffective, rapid, inexpensive, effective testing that's widely available, then that may give us at least some sense of security. Of course, up to 15% of these tests may be inaccurate, and so it's not 100%. Plus, you've also got the potential for asymptomatic spreading of the virus. So people that don't feel sick and aren't running a fever could still potentially spread it. So it's really a matter of how personally risk averse an individual is. I'm sure there will be some people who, are very, very risk avoidant, whereas others, well, I mean, you see these idiots out there, doing demonstrations and so on. And sorry to inject a little value judgment there, but anyway.
Well, it's very interesting you bring it up. I've spoken to law enforcement in recent days, both in San Diego and Orange counties, and it's a delicate balance because I'm a strong proponent of the First Amendment, obviously, and I fully support people's right to assemble and to express their opinions. Where I think it becomes tricky is when there's a possibility that people are endangering public health. So I think that's the balance that our law enforcement has to deal with. And I actually think from everything that I've heard, I think our law enforcement that I've spoken with are being pretty thoughtful about understanding that balance. But make no mistake, this is going to be with us, from everything I've heard, going to be with us for some time in one shape or form. Doctor, I don't know if you saw, I'm sure you did, Bob Redfield, the head of the CDC, yesterday say we're going to have a second wave that might be worse than the first. Any comment or any thought on that?
I think it's good for us to be prepared for that. In the winter season, if this becomes another sort of a seasonal, viral thing that recurs every year, there's a pretty decent chance that may happen. And obviously, once people start getting out and about more, there are going to be more cases because right now we're doing a good job of, staying away from each other. So I hope that's not the case, but those are brilliant scientific minds working on it. It's like any of these models. We don't know for sure, but I don't believe that's necessarily a worst case scenario. I think that is what they believe. They think that's sort of in the middle of what's likely to happen.
Thank you. A couple questions from the Facebook feed. Jeff asks, and this is evidence that we will take tough questions. He asks, when are you going back to work? I see the Senate is working. Jeff, it feels like I never stopped. We've been here at our homes across the country, but we've been working trying to help our communities straight through in a variety of ways. Speaking in forums like this, I think this is now our 9th virtual town hall all in, and I think we've had between, probably close to 100 different Zoom meetings with our community stakeholders, our mayors, city managers, school districts, police and fire. I mean, you name it. We're out there trying to understand and develop good public policy that's going to help our community and a whole lot of our small businesses as well, our chambers and our business groups as well. I'm actually flying back tonight, as I think I've said twice now, to vote on this third or 3.5, you could call it, interim emergency relief bill. And I look forward to getting back and being able to be in the Capitol just as normal. That'll mean that we've gotten past the worst of the need to remain in our different districts throughout the United States. I'm also very mindful of the fact that a lot of my colleagues are in higher risk age brackets or have pre-existing respiratory or other conditions that might put them at higher risk of this. So, the fact that I can get on a plane tonight and go vote when a lot of my colleagues cannot, I'm very mindful of that. And I do think it's important that we continue to explore remote voting. I know there was a push to do that this week, and unfortunately, we didn't have the bipartisan buy-in from the minority leader, Kevin McCarthy, to be able to proceed with that the way that we'd hoped. But I also know that there's going to be a bipartisan group that comes together, both the House Rules Committee and the House Administration Committee, to try to figure out how we move forward with some sort of remote voting as necessary throughout the pandemic. So plenty is being done. It's like every business across the United States and every organization across the United States is being done in a very atypical way, as many of us are stuck in our respective states and homes. But thank you for the question. Next is an anonymous question from Carlsbad. The Trump administration this year planned to divert $7.2 billion in Pentagon funding for border wall construction. Can this money be rediverted for use in the COVID-19 relief fund? Well, let me say that I strongly opposed diverting those funds for the border wall. I'm a strong proponent of border security. through technology and through personnel, and that's based on my conversations on the ground with those at the border, CBP and others, asking them what they need. And so I haven't been a proponent of redirecting, for example, military construction funds to go towards a border wall. I've advocated to keep our funding for Camp Pendleton, and we've been successful in that regard, getting a lot of long overdue infrastructure funds for Marine Corps Base Camp Pendleton. We're very proud of that. Just the same, I wouldn't divert funding away from how Congress intended for it to be spent in general. On principle, I think that Congress has the power of the purse. We go through our appropriations process. That is reflective of our priorities, and that needs to be meaningful rather than just have funding redirected from one pot to the other. An example of this, when all this started with COVID-19, the first bill that we did, the administration came to us and said $2.5 billion, of which 1.25 would come from other pandemic assistance funding, like Ebola as an example. We said, no, Congress has already appropriated that other money. That money needs to go for its intended purpose. We need additional funds for COVID-19. So at the time, we allocated an additional $8.3 billion in supplemental appropriation for COVID-19 for the vaccine. At the time, it seemed like a lot of money. It is a lot of money. $8.3 billion is a lot of money. In hindsight, it was barely scratching the surface of what we would soon determine to be necessary. But my point is, we've got to stick to the power of the purse as intended by the framers of the Constitution, which stands with the Congress. And I'll be a steadfast advocate for that. John has a medical question for Dr. Steinberg. He says, yesterday, San Diego had 57 new cases of COVID-19. How did those people get infected? Are they essential workers, following guidelines but had bad luck, or careless, disregarding social distancing guidelines, or not? This is important information for us, following guidelines and attempting to weather the storm.
Yeah, I think we need to get Linda involved and get her to do some contact tracing and try to figure that out. That probably was from a couple days ago because between day before yesterday and yesterday, there were over 100 new cases, and that was the most we'd had since April 2nd. So again, maybe because more tests are being done, but obviously a little concerning because we had really flattened out to about 50 or so new cases in the county a day. But remember, these are cases, not serious, not hospitalizations, not ICU, not deaths, just positive tests. But in answer to your question as to where are these people getting it, we don't really know. I mean, some of them may get it, they're going out to the grocery store. Some may just not be following social isolation, and some may be exposed to it, with asymptomatic individuals. So I wish we could figure out where every single person got it. It might help us do a better job of preventing it moving forward. And I think that'll be our goal, is to try to figure those things out. But as to those 50 or 100 people, we really don't know.
Thank you for that, Doctor. Next question, and these are all from our Facebook Live feed. Judith asks, any information on when we may expect our stimulus deposits? Well, Judith, I would hope that you would have, if you're an electronic filer with the IRS, that you would have already received your direct deposit. So if that's not the case, you could go to the IRS website. They have a portal where you can sign up and provide your direct deposit information. I would suggest that you would do that. If you really, really want a paper check, they're doing $5 million a month with the lowest adjusted gross income receiving their checks first. So that could take some time. So I would sign up for that direct deposit. The other thing worth mentioning is that there are some scammers out there who are saying, oh, just give us 10% and then we'll make sure you get the money. That's a complete scam, and you don't need to worry about that, because it's absolutely not what the intent was of the program. Nobody should be making money on that sort of scam. Next one is from Cheryl. Cheryl asks, how are you making sure that the caregivers at the nursing facilities and hospice locations are not infected with COVID-19 and bring it into the facilities, that is presuming that visitors are not being allowed? Dr. Steinberg, I think that is for you.
Yes. So the first part is that visitors are not being allowed in skilled nursing facilities. Only really essential people. In fact, some facilities aren't even letting doctors in. They're, because they can do these sort of telehealth visits. And I work with Hospice by the Sea. There are some nursing homes that aren't even letting our hospice nurses in for the same types of reasons. As to what they're doing to ensure that workers aren't bringing the virus into these vulnerable populations is, they do temperature screening, they do symptom screening for everybody coming on and off shift, and if they have a fever, they're sent home. Some facilities are also doing oximetry testing to see if your oxygen level is below normal. But those things are not surefire, right? You can be infectious for a few days beforehand. So what we really hope moving forward is that, and especially now that the governor has prioritized people in skilled nursing facilities, both workers and residents, to priority level 2, for testing, that as more tests become available, we can start doing actual testing, point of care testing, to help ensure that we're not inadvertently bringing it into these facilities, because it's a disaster when it gets in.
Thank you for that, Doctor. Andreas, and we've just got a time for just a few more. Andreas asks, how will you be working with our biotech and pharmaceutical companies to expedite treatments and a potential cure? Andreas, it's a great question. We have been working with a ton of them to try to expedite when we see diagnostics or we see therapeutics or potential for a vaccine coming from our region, coming from our area. We're trying as best we can to ensure that we're connecting the dots with the right people within the administration and the federal government, that we're trying to advocate for emergency use authorization when it's appropriate to do so, that we're fighting for essential classification of our life sciences industry as appropriate to do so, and obviously that we're advocating for additional funds for things like NIH and NSF and other important and necessary sources of money for further research and development and deployment of therapeutics and diagnostics and eventually a vaccine. So I'm all in to help our local biotech and life sciences community. We've been working very hard to do it, and we'll continue to do so. And I'm extremely proud of the work that's been done in the industry as of late, where a lot of companies are doing things not because it's the most lucrative. In many cases, it's far less of a lucrative endeavor to be focused on COVID-19, but nonetheless really, really significant and a huge service to our country and really to the world for our leading experts and minds in North County, San Diego, and throughout our region to be engaged in, again, the cure, to the extent that a therapeutic can exist, that a vaccine can exist, and that the diagnostics are up to the challenge. So very, very proud of our local industry. Just a couple more. Jeffrey, here's a medical one for Dr. Steinberg. Jeffrey asks, can you get COVID-19 from surfaces by taking out your garbage and recycling cans to the curb?
Well, it depends on who's been touching your recyclables and your garbage, I guess. I think that's extremely low risk. If it's just been you and your family in the house and you've been socially distancing and so on, probably nobody's been out there touching your garbage can. So when you lift it up, but just like normal, I would say take it out there and then come back in. Wash your hands real well. Don't touch your face, and I think you should be good.
So I think that Jeffrey knows that tomorrow is my garbage pickup day, and my wife will be very happy that I will be taking out the trash before getting on that airplane later. But I'll be sure to wash my hands before I get back into my car and drive to the airport.
Yeah, don't forget to wipe down the stuff in the airplane too.
Man, I'm bringing an entire thing of hand wipes, and it is what it is. Let's see. No, we did that one. Okay, Monica in San Clemente, another medical one for you, Dr. Steinberg. Monica asks, how can we get mass testing up and operational in California? Piece of cake, right?
Yeah, well, we're moving towards it, and I mean, I applaud the governor for pushing us in that direction. It's been extremely disappointing and discouraging, and just kind of baffling that in a big, wealthy, technologically advanced country like ours, that it has taken this long to get these tests produced. I really think this is the kind of thing that the federal government probably should have been more active in. But they're sort of punting it to the states, and I think the states are doing the best they can to get testing mass produced and to get it out there. But we're still nowhere near that. I mean, there are hospitals right now that don't want to test a patient before they go to a nursing home because they don't want to delay it, and or they don't meet the criteria. They've already had it. Of course, a nursing home likes to have 2 negative tests, like the CDC recommends, before taking somebody in who's had COVID. So I hope it won't be too long. It's disappointing that it's taken this long, because I think that is going to be key to things resuming some sort of normalcy. That's going to go a long way, both antibody testing and swab RNA testing.
Thank you for that. And, I think the only thing I would add is that we're going to have a national testing strategy because of the work that we did in Congress on this last bill. It requires administration within 30 days to develop that testing strategy. It's so important because we've been receiving mixed messages on this. One day we'll hear from the president that, he's in charge and the states, are not. And then the next day we hear it's up to the states. But we now know in this bill that presumably the president will be signing into law tomorrow or the next day, that they have to now create a national testing strategy within 30 days. So I'm very proud of that accomplishment.
Thank you.
With that, we have gone through the questions that we've got time to go through. We've got just a couple minutes left. And what I thought is, if Danny or Dr. Steinberg, if you have any closing comments, and since we started with Danny with the opening comments, perhaps we could go to Dr. Steinberg for some closing comments from a medical perspective, kind of where things are and what you expect to happen next.
Sure. I think we're a long way from getting back to what the new normal will be, but I think we're on the road to that, and I think we will start to see some things start to open back up. And I just really want to thank everybody for enduring this hardship, because while there are good things that have come out of it, and I'm sure the environment's much happier right now than it was before this all started. It is a real hardship for many people, and thank you for continuing to observe social distancing and observe the guidelines. So I think it's a marathon, not a sprint, and we should expect to see things sort of incrementally start to get better. But again, we've been truly blessed, here in the 49th district, as far as the severity with which this horrible, insidious disease has hit so far. And let's not get overconfident and have a horrible second wave. Let's try to continue to be vigilant. And I want to thank our congressman for being a great guy and just really looking out for your constituents. So I hope you don't mind if I say that.
Well, I thank you, Doctor, and your work on the front line of this, and all medical professionals and everybody working on the front lines. That is far more important than anything that I do or anything that members of Congress do. I guess we help direct a lot of resources, but ultimately those on the front lines are the ones who truly deserve our thanks, and I'm just truly grateful. And that goes also for those who are driving the delivery trucks and moving our goods around so people can get access to basic food and the goods that they need. It goes for all those working in our grocery stores, and certainly our frontline law enforcement and emergency medical professionals. They're just absolutely doing amazing work every single day. So we're truly grateful to all of them. And we're also grateful to all of our small businesses, and many of them need a lot of help. And actually, before I get move from Carl, how do I follow you on Twitter, Carl?
Oh, it's at Carl Steinberg. It's KarlSteinberg.
I can't forget that, right? So, Danny, if you want to wrap up for small businesses out there that are watching and listening to this, how they can work with you, what the website is, how they can follow you, and the general guidance and advice that you have for our small business community in the 49th.
Absolutely. And again, thank you for the opportunity to come on here. We know at the SBDC that the small businesses are heavily impacted by the situation. We're talking to folks day in, day out about the impacts and helping small business owners navigate through the different types of assistance that's out there. So you can visit our website, which is sdivsbdc.org. You could also go to americassbdc.org and click find your local SBDC, because there's also SBDCs in South Orange County as well. And we're here to be able to assist and work with you, the small business owner, navigate through the Paycheck Protection Program, the Economic Injury Disaster Loan, but not only that, to take advantage of some of the local assistance. We're excited that very soon there will be some local programs that the County of San Diego funded yesterday for the unincorporated parts of San Diego County. We'll be working closely with the county to implement that as well. And as well, make sure you follow, you keep up to date with what is actually going on. A lot of times there's a lot of confusion, a lot of misinformation that's out there. And as the congressman said, be careful of scams. If you don't know that they're an SBA approved lender, or if it's not anything, understand that all these services are at no cost. There's no cost to apply to any of these programs. These programs are easy to do. The SBDC is here to assist you. Your local chambers of commerce are here to assist you, all at no cost, and you do not need to pay any money to apply for these particular programs. So be very careful. If people ask you for additional information, if it's not from a .gov email or from a known and trusted source, assume it is not a trusted source, and be very, very careful for that. Again, we're the San Diego and Imperial Small Business Development Center. Our website is sdivsbdc.org, and you click request counseling and we'll be able to assist you.
Thank you so much, Danny, and thank you, Dr. Steinberg, and to everybody watching. I'm very grateful that you spent some time with us this afternoon. I hope this was informative. We'll be doing these every week as long as this pandemic is ongoing. And most importantly, I want to thank my wonderful team again in Washington, D.C., and also in Oceanside and in Dana Point, our great chief, Kara, and our communications director, Eric, our legislative director, Jonathan, and the whole legislative team, as well as our entire constituent services team that are just doing an amazing, amazing job helping our community get through the crisis. And one day at a time, we will get through this together. Grateful again to Jeremy and all the team doing the video conferencing today. I encourage you to go to our website, again, mikelevin.house.gov, where you can find our COVID-19 resources that hopefully will be of assistance to you. But please do follow those guidelines, both the federal, the state, and the local guidelines. We're so grateful that everyone in our community, most everyone anyway, is acting in accordance with those guidelines and really out of kindness, generosity, and really representing the best of what makes our community so special. So thank you again. I hope everybody has a healthy and a safe week. And until next time, we'll see you then.
Safe travels.